And I'm going to introduce Dr. Ken Leonard, who will move on to the next topic. Dr. Leonard is director of the Research Institute of Addictions and research professor in psychiatry at the University of Buffalo Medical School. His research interests have been centered on the interpersonal and familial influences on substance abuse, and he is internationally recognized for his research on substance abuse and intimate partner violence.
Thanks, Peggy. Peggy mentioned that one of the things that's different with regard to alcohol and alcohol use disorders, she mentioned this yesterday, is that with alcohol we have both the chronic alcohol use disorder potential for violence, as well as the acute effects of alcohol. And in many instances, and much of the research, is very difficult to discriminate between the two of those. And so as I go through this, I just want you to keep that in mind. I'll be talking largely about intimate partner violence. There's been just an extensive amount of work on that, and yet there's been pushback in terms of whether alcohol has any causal contribution. And so much of my talk is organized around epidemiological evidence for causality, and I think that's all I wanted to say with this slide. So one of the first key things that's important is to recognize that the relationship between excessive alcohol use, either measured as a disorder or as measured in terms of people's drinking patterns, has been observed in a number of different cultures. This is a map that I've colored in myself for every country where I found a decent case control study demonstrating the effect between alcohol and violence. And the most recent one was done by a group of skeptics at the World Health Organization, the multi-country study of domestic violence, and found associations in Brazil and Japan and a series of other countries. So what's important about this is that this relationship is found in countries with traditionally very strict alcohol norms, as well as countries that have less strict alcohol norms. It's been found in countries that are known for fairly heavy amounts of violence, as well as countries that are not known to have high levels of violence. So whatever kind of cultural overlay that you might want to think of, alcohol seems to transcend that. And the finding that it actually increased aggression in Japan was sort of the nail in the coffin for me. The relationship between alcohol and domestic violence has been observed in lots of different samples. So this should convince us that this is not simply it's not a sample-specific kind of an issue, and it's not a finding that's related to how people show up at our doorstep. So it's not just seen in clinical populations, although it is seen. It's seen in alcoholics. It's seen in batterers when we look at the extent of battering and look at that relative to their drinking patterns. It's seen in people who come to the emergency room, and then it's seen in samples that are more representative, such as primary care studies, as well as nationally representative studies and locally representative studies. And the effects of those are fairly similar. The association between alcohol and domestic violence represents an association that's at least of moderate strength and has been shown longitudinally. This is a meta-analysis that was done about 15 years ago, and it demonstrated that whether you're looking at criminal violence or domestic violence, that there's about a twofold increase from the lowest 50% of alcohol consumers to the highest 50% of alcohol consumers. And as Klaus mentioned, that sort of belies the rate of violence at the very high levels of alcohol use. More recent meta-analysis have been done in 2004 and 2008, and they've demonstrated basically the same thing. And as we've expanded the number of studies and focused those studies more specifically on partner violence, the effect size has remained roughly the same, about 0.2. 0.2 was basically what was reflected in the previous figure. This is one of the longitudinal studies. It was one of my early studies. This was looking at alcohol in the context of newly married couples. And I put this up here not to trace all the past, but just to show that we control for lots of background factors, including husband and wife marital aggression before marriage. We look at husband's history of family violence. We look at hostility. We look at how the husband and wife actually interact, what their typical pattern of marital conflict resolution is. And even in that context, we see a fairly significant effect of the husband's score on the alcohol dependence scale as being predictive of marital violence in the first year. A more recent one with an older sample across 2 years found a very similar thing, that husband's alcohol problems were longitudinally predictive of physical marital aggression. I put this slide up here just to demonstrate that we're aware also that marital aggression can feed into alcohol problems, and that's a whole nother talk. While I think we don't have a really great handle on what the sort of the chronic effects of alcohol are, and there's reasons for that maybe in the discussion we can get into. But it does appear that that part of this relationship is due to the acute effects of alcohol. And we know this from two basic sources aside from Klaus's research, which demonstrates that in animals. One of those is event-based research, and that's where we look very carefully at violent events versus some other kind of event that seems comparable. So in partner violence, we might look at a violent event and then an event that had the potential to turn into violence but did not. So the most severe argument that a couple might have had that did not result in violence. And then the other way is through experimental studies, largely with college students in which we administer them alcohol. This is an example. There are many others that looks at the presence of alcohol according to both husband and wife report in verbal aggressive conflicts, conflicts that involve moderate physical aggression, and conflicts that involve severe aggression. And you can see that husband's drinking is very strongly associated with with serious domestic violence. The picture with regard to wife's drinking is less clear. That's the entire, I guess for you that would be the entire left side of the graph, entire right side of the graph, sorry. For me, it's the entire left side of the graph. And again, that's something we might come back to in the discussion. This shows that this effect, you can see a similar effect even if you're dealing with people who are in treatment for alcoholism. This is men and women describing conflict episodes that either did or did not involve violence in the previous months before they showed up for treatment. And they asked them about their drinking in that day. They asked them about their body weight. They asked them how fast they drank. They came up with an estimated BAC. And those events that had alcohol involvement had, those events that had physical conflict, violence, the husbands had a higher BAC. And that's both according to husband's report and to some extent according to wife report. General experimental studies of alcohol and aggression. You all know what the benefits of being able to do an experimental study on alcohol and aggression is, and you all know what the limitations are. It's usually a mild aggressive act. It's not like violence we see in the community, but there have been several hundred studies that have been done using this sort of paradigm. This is a typical one where there's a subject who either does or does not have alcohol, is competing with somebody who's in another room. The winner of that competition gets to set a shock for the person that loses, and the intensity of shock that they choose is our measure of aggression. Meta-analysis of this study. These studies have shown that alcohol leads to a major increase in physical aggression in those experiments, whereas a placebo has almost no effect whatsoever. And furthermore, studies that have have incorporated multiple blood alcohol levels, we find that the higher the blood alcohol level, the larger the effect on aggression. There have been several studies that have looked at alcohol and more aversive verbal behavior. This makes sense in the context of domestic violence because alcohol seems to, or violence seems to emerge out of some ongoing verbal conflict. It seems like it's a more natural response, and it's less artificial. Couples naturally, you bring them into a room, you let them talk about something that they have conflict about, and sooner or later they start getting angry. And so there have been a couple of studies that have done this. This was a study that I did back in the 90s. In this study, under the baseline condition, everybody, all the couples, discussed a conflictual situation in their relationship that they had agreed to talk with. What's critical about the baseline is the baseline was conducted sober for every couple. Okay, so the baseline, there's no alcohol involved for anybody. We separated the couple. We had them go do some additional tasks. We gave just the husband alcohol and then returned them to talk about another conflict. And what we see in this is that the interaction that then emerges is one that's marked by very high levels of negativity on the part of both husband and wife, and that's an effect that we do not see when we give them a fairly credible placebo. This is a study that was done actually before that with a sort of similar paradigm by Ted Jacob. I put this slide up here just to demonstrate that the effect that we see in his study, and I didn't have this measure in my study, is that alcohol seems to have its strongest impact among alcoholics who have some antisocial tendencies. So not all alcoholics are antisocial. A number of them sit at home, drink a six-pack, and watch football on TV, and are not sort of the externalizing people that we talked about yesterday. So antisocial alcoholics, that's where we saw the really major increase in terms of negativity when they had the opportunity to consume alcohol and discuss a conflictual reaction with their partner. So from a theoretical perspective, the most common theory that we think about is these cognitive disruption models, and the notion behind these is that intoxication leads to some level of cognitive impairment, and that people deal with that cognitive impairment, probably they learn to deal with that cognitive impairment by focusing on the most salient aspects of the context and not picking up on the more subtle cues that might be in that situation. So if the situation is a situation that evokes hostility and evokes aggression, that alcohol ought to exacerbate that. If the context is one that evokes more maudlin type events like a going away party, you're not likely to see alcohol exacerbating aggression, but maybe sadness. So the notion is that alcohol exacerbates a person's reaction to the most dominant cues, and any other cues that are in the peripheral that might inhibit that are not focused on and not processed as deeply. This leads us to a couple of implications: that intoxication ought to lead to behavior that's consistent with the dominant cue, and that factors that lead to hostile cues or aggressive responses should interact with alcohol, and factors that are associated with diminished responses to inhibitory cues should interact with alcohol. So we ought to see its biggest effects for people who already have that push towards aggression, and those people who do not have those breaks towards aggression. And I show you two and this is a sort of a summary of different kinds of constructs that have been shown either in experimental studies or in epidemiologic studies to interact with alcohol to predict higher levels of aggression. So hostility, marital satisfaction, verbal aggression, stress, and just general negative affect. Show you two studies real briefly. The first one is an experimental study, and the key takeaway here is the people who showed the highest increase in aggression in that experimental paradigm that I described earlier were those who were high in trait anger and low in anger control. So aggressive people with low inhibitions were the ones that were the most responsive to alcohol. And this is something that demonstrates something very similar longitudinally with epidemiologic data that shows that the people who are the most aggressive with high levels of alcohol dependence are those who are high hostile and engage in a lot of maladaptive coping. I'm going to finish up real briefly just with the comment that to the extent, and to bring it back to the whole mental illness and some of the material we saw yesterday, is that to the extent that mental illness is associated, and I say not all mental illness is associated, but to the extent that it's associated with negative affect or stress and impaired self-control, that would lead us to believe that alcohol might interact with psychopathology to create a particularly high risk of violence. I show this from yesterday just to demonstrate that that if you look at this carefully, it does suggest a synergistic effect for alcohol use disorder or substance use disorders for any of the various mental illnesses that were addressed in this study. I should also mention that in this study, in addition to substance use disorder, that they found a role for hazardous drinking. So hazardous drinking had an impact on violence over and above the effect of substance use disorders. And then finally, successful treatment seems to have an impact and reduce the aggression. And I won't show those slides because of time, but if you treat somebody and they maintain sobriety, the level of violence, the level of verbal violence, the level of physical violence drops. If they relapse, the rate of violence increases again. So I'll stop there.
Thanks, Ken.